What reduces recurrent stroke risk? Imagine a world where strokes are less likely to happen again. The good news is that many strategies can help lower the chance of having another stroke. It all starts with managing the health of your blood vessels and your overall wellness. Controlling blood pressure is one of the most effective ways to prevent a second stroke. High blood pressure, or hypertension, is a major risk factor that can be changed. Doctors often aim for a blood pressure below 140/90 millimeters of mercury for most people. For those with a history of certain types of stroke, a target below 130/80 might be recommended. Lifestyle changes like losing weight, eating a heart-healthy diet such as the Mediterranean diet, reducing salt intake, exercising regularly, and limiting alcohol can make a big difference. These steps help keep blood pressure in check and support overall brain health. Taking medications like aspirin or other antiplatelet drugs is also key. For people who have had an unheart-related stroke or a mini-stroke, a daily aspirin can help prevent clots from forming. Sometimes, for a short period, a combination of aspirin and another drug like clopidogrel is used to boost protection without increasing bleeding risks too much. It's important to follow your doctor's advice because treatment plans are tailored to each person's unique situation. Lowering cholesterol levels is another important step. High levels of bad cholesterol, known as low-density lipoprotein cholesterol, can clog arteries and increase stroke risk. Doctors often prescribe high-dose statins to lower these levels. For some patients who don't reach their goals, newer medications like PCSK9 inhibitors might be considered. Keeping cholesterol in a healthy range helps prevent artery narrowing and reduces the chance of future strokes. Managing other health conditions like diabetes and atrial fibrillation is equally vital. Proper blood sugar control can reduce damage to blood vessels, and for those with atrial fibrillation, blood thinners are often prescribed to prevent blood clots from forming in the heart and traveling to the brain. Screening for irregular heart rhythms and other sources of embolism is part of a comprehensive approach to prevent strokes from happening again. Lifestyle habits play a big role too. Regular physical activity, eating a balanced diet rich in fruits, vegetables, and healthy fats, quitting smoking, and limiting alcohol all support healthy blood vessels and reduce stroke risk. These changes complement medication and medical procedures, creating a strong defense against recurrent strokes. In some cases, procedures like carotid endarterectomy or carotid artery stenting are recommended if there is significant narrowing of the carotid arteries. These procedures can remove or bypass blockages to prevent future strokes. For intracranial artery narrowing, however, medical management with medications is usually preferred because procedures carry higher risks and often don't show long-term benefits. Other considerations include managing a patent foramen ovale, a small hole in the heart that can sometimes cause strokes, especially in younger people. Vaccinations, like the flu shot, are also recommended because infections can trigger blood clots and increase stroke risk. If surgery or other procedures are needed, careful management of blood thinners around the time of surgery is essential to prevent bleeding complications. Every person's risk factors and health profile are different, so it's crucial to work closely with healthcare providers. They can develop a personalized plan that includes medication, lifestyle changes, and possibly procedures to keep your brain healthy and reduce the chance of another stroke. Remember, controlling blood pressure and cholesterol, taking the right medications, making healthy lifestyle choices, and managing other health conditions are all proven ways to lower your risk. Always consult your doctor for advice, tailored specifically to you and your health needs.